We are still talking about Dr. Windell Boutte, the Atlanta area surgeon who documented, if that's what you want to call this, her procedures and some patients' body parts, too, in a series of homemade music videos from the OR. But Dr. Boutte just lost her medical license, at least temporarily. All of this as she opens up exclusively to HLN and Michael Lanos about her videos and her malpractice lawsuits as well. My panel is back with me, and Dr. Turk, there is one particular video that I'd like you to see, but at the same time, I'd like you to see the answers that she gives Mike, especially when Mike puts it to her. I mean, come on, isn't there anything that you can see wrong with what's going on here? Have a look.
As this has been a rough period, let's say, with some allegations coming your way and complaints, as I've mentioned, have you done the soul searching and thought to yourself, did I do something wrong? And what have you come up with?
Yes, I've done the soul searching. And no, I've done nothing wrong.
And you are confident that you never look back and go, you know what, I got a little carried away with the singing and dancing, and maybe I wasn't as focused as I needed to be on the procedure.
Well, the procedures, 99% were done. They were already done.
But even in that 1%, you're
even
confident?
In that 1%, no, because it's 30 to 60 seconds. 30 to 60 seconds in the realm of what takes 3 to 4 hours of a surgery. 30 to 60 seconds, think of that. And you know, you have other people monitoring. They're on a continuous monitor, monitoring CO2, oxygen, heart rate, blood pressure, you know, oxygen saturation, all of that good stuff. That's taken care of. I got that. That body on the table is my #1 concern. So if it takes me 30 seconds to pre-design, pre-stage, pre-plan, I know exactly when to do it, hit it, done. Let's go.
Okay. Dr. Turk, she says it's only 30 to 60 seconds. I think the cut it video, at least our, you know, what we're going to show is about 57 seconds, so clearly it's at the top end of that. Is there anything wrong with that? Say, taking a minute out while someone's under anesthesia to do something not surgery related?
Yeah, I would say exactly, not surgery related. There are times when things are delayed for good reason in the operating room. But to put on a show or to dance, I don't know any operating room in the world where that would be considered good medical practice or accepted behavior. And the idea is to get people off the table and off anesthesia as quickly and safely as possible.
And not to prolong it, especially with something sort of
trivial and yeah, and unnecessary. I mean, you know, we all do have our, you know, surgeons do listen to music sometimes in the operating room. We have our routines. But this goes, you know, well beyond, you know, acceptable behavior.
She mentioned to Mike in that last little bit that it's just 30 to 60 seconds or so, and usually it's been 99% done. These procedures are all 99% of them are done. It's at the end when they're I've sutured them up and all the rest, and yet she herself refutes it on her own videos. I think the video of called Build a Butt. If we could play the Build a Butt, she explains what she's doing on that one. Let's play it.
All right, we're halfway through with our Boutte Build a Butt workshop day. And here you can see this side is not done yet. It's still flaccid. Muscles are not quite toned. Okay, so you know it's almost Christmas. And
okay, Dr. Turk. Dr. Turk, she says we're about halfway done, and this side's done, and this side's not done. And I hear very heavy breathing. She has also said that many of these patients were awake, and so awake, in fact, that she had to tell them to be still. Have a listen to her explain the patients on the table and how awake they are, given the fact we just heard all that heavy sedated breathing. Take a look.
These videos are consented, and it is pre-discussed with the patients at what safe interval that a 30 to 60 second video can be shot. Mostly, I would say 98% of them are in the post-operative period, in the recovery period. During the 30 to 60 seconds, the patient loves that song. That's why she chose it. And I'm telling them, look, you got to be still. I'm going to shoot your 30 seconds, you know, because they're aware of what's going on here. And so I'm like, you got to stay still so I can shoot this. I've had patients to dance on the table with the song because that's their song, and they want to celebrate that. And I would just say, no, you have to stay still. So It's under safe, controlled circumstances, consented circumstances. No harm was done, no issues with infections.
Okay, so much to sort through here, Doctor. Number one, she says that they're awake to the point where she has to tell them to be still. That sure didn't sound like it with that patient breathing heavily. She said it's the end of the procedure when I'm doing this. She explains it herself. She's mid-procedure. We saw her cutting into a patient during the Cut It video. We can just play some video and sound of that while you and I are talking to prove the point that it is absolutely not mid-procedure. It's at the beginning of the procedure when she cut it right into the patient. But there's also the notion of the sterile environment. Where are the infractions here that you see in a sterile environment like an OR?
So if you just see the video that's on now, there are people with sterile gloves on touching their face, touching parts of their body and clothes that are not sterile. There's one of the videos where she actually goes to adjust her mask, which is not a
She was just touching her face, like
feel.
she just had her gloved hand on her face.
Yeah, which is absolutely a violation of sterile technique. And in these types of procedures especially, you know, these are strict sterile cases. And, you know, when people are singing and dancing and moving their hands in areas that may not be sterile below the operating room table.
So you're saying that the hands have to stay above the operating room table, but many of these videos show the hands not only down below, but also on the buttocks.
Yeah.
Like they're putting their hands gloved on their, what look like the street clothes in the back of the open gown.
Yeah, and much worse, you know, grabbing, you know, things in the operating room that are not sterile themselves. Immediately precludes it from being a safe, clean, sterile case.
Can I just ask you a simple question? These women are coming in because they don't like something on them and they want things changed. Is that the kind of woman who would say, show me naked, take videos of my naked body and put it on the internet? Because, by the way, we digitized it.
Yeah, I think that would be a no. You know, most people coming in are interested in having quality work done in a safe, private, very professional environment, and this is anything but. You know, people, you know, do have sometimes requests of music they might like to listen to, but they certainly don't expect to be end up on social media with their bodies shown and, you know, really exposed
Or
and taken
body parts,
advantage
as
of.
in the case of this video. I have to leave it there, but my thanks to all of you. Mike Galanos, your great interview. So appreciate it. Susan Witt, stay on top of this for us. Let us know what happens. Ojay Liburd, our best to your mom. Dr. John Turk, thank you so much for your expertise. And William Bruised, I'm going to ask you to stay put. I need you in the next couple of segments because we've got more details tonight.